everyone. Thank you so much for joining us tonight. We are excited to have this conversation tonight with you, along with our three panelists. My name is Alexis, and I am with The Patient Story. Just to give you a little bit background on what The Patient Story is and our platform, we do in-depth storytelling with cancer patients, and all three of our panelists tonight actually have shared their story on our platform. We also have live discussions with top cancer specialists to get the latest information on top treatments and new therapies. So tonight, the topic is how to deal with scanxiety. Right now, I'm going to toss it over to Nick Mundy to tell us a little bit more about the topic and really an introduction and what's ahead.
Alexis, thank you so much. And Patient Story, thank you for having all of us and hosting this tonight. Like Alexis said, my name is Nick Mundy. I live in the Cincinnati area. I am 33 years old. I am a two-time thriver of non-Hodgkin lymphoma. I just finished chemotherapy 8 weeks ago on May 24th for a diagnosis of stage 4 diffuse large B-cell lymphoma with liver metastasis. And so right now, I'm at a frequency of every 3 months where I'm getting scans. But I've been getting scans and dealing with scanxiety long before I ever knew what scanxiety was, for about the last decade, since I was about 23. And before I kick it over to our next panelist, Matt, I do want to give a brief description or a definition that we were able to pull together of what scanxiety is. So scanxiety might be closely related to PTSD and or the fear of relapse. According to Dana-Farber Cancer Institute, common symptoms include irritability, sweaty palms, increased heart rate, and nausea in the time leading up to an exam. I can tell you that I personally think I have all of those signs and symptoms when I'm dealing with scanxiety. The irritability is off the charts. The sweaty palms, I think I've got some of that right now. The increased heart rate, even my bowels kind of change. But the best part about this tonight is that we're going to talk about how do we deal with it. And so to kick it over to Matt Ode, I would love to hear a little introduction and, what does scanxiety look like for you, Matt?
Yeah, thank you, Nick. I appreciate it, man. And hello, everyone. Once again, thank you to the Patient Story for having us. I think this is such an important topic because no matter who we are, when we're going through cancer, we all face this. We all face the scanxiety. We all face some type of anxiety. And before we get into all that, a little bit about myself. I'm 31 years old from Cleveland, Ohio. At the age of 24, I was diagnosed with stage 4 testicular cancer. The doctors found an 11-centimeter tumor in my small intestine. I went through 5 rounds of what's called BEP, bleomycin etoposide cisplatin. Then I ended up having many complications just after, where I had multiple surgeries, which led me into kidney and liver failure. I was in a coma for 2 weeks. I ended up being in the ICU for over 40 days. I basically had to relearn to walk and relive my entire life again at the age of 25. And, talking about scanxiety, when I was rebuilding my life and rebuilding myself every 3 months, just as Nick was talking about, I'd go in and get scans, and it can be very stressful at times. But what I always say is, as you continue to prepare yourself, as you continue to do the things you can control in your life and focus on the things you can control in your life, time will help heal through this process. And as we continue to heal through ourselves through cancer, we also heal through ourselves through anxiety and the scanxiety as well. And, today I am very blessed to say that I am 6 years cancer free. I now only have to do 1 year scans. So for some of you, it may turn from 3 months to 6 months to only a year scan, or, everyone's at a different pace and a different times, frame in their life. But that's just a little story about myself. And I'm going to kick it off to Lainie over here, and I'll let her share her story as well.
Awesome. Thanks, Matt. And as well, thank you so much to the Patient Story for having us and just for the amazing community that you guys have created. I'm so honored to be here tonight to share a little bit about myself and as well as how I deal with scanxiety. A little bit about me. I am 39 years old. I live in South Florida. I'm the only Ohio person the non-Ohio person on this panel. I live in South Florida, and I am a 5-time cancer survivor. My first cancer diagnosis was at 18 18 months old. So the word survivor has been something that has stuck with me throughout my entire life. And then my next diagnosis was at 24 with breast cancer. And then I had melanoma at 25, 26, I had thyroid cancer. And then I also had sarcoma and another relapse of stage 0 adrenal cortical carcinoma. So for myself, really, dealing with anxiety, obviously, is something I deal with all the time. My scan routine is every 3 months. And of course, it looks very different for every person. So I always like to say that. But because I live with a rare genetic mutation called Leaf-Ramini syndrome, I am monitored very closely. Really, I'm excited to just be here tonight and just talk about this open conversation, because I think it's something that's not talked about enough. And I think all of us can really help, ease a little bit. I know the description says increased heart rate, sweaty palms. I think something for me that I always experience is loss of sleep the night before a scan and leading up about 2 weeks before. So I'm really excited to be here tonight.
Amazing. Thank you so much, Matt. Thank you so much, Lainie. And so let's just jump right in. Let's get down to the meat and potatoes of why we were here, or why we're all here tonight. And that's, how do we deal with scanxiety? What are some of the tips? What are some of the tricks? What are some of the resources that we all are using or utilizing that we can share here to potentially give someone else some hope, or give them a tool or a resource that they might not have in their bag right now? And to start us off, Lainie, I would love for you to kick it. You've got a beautiful outlook, and you've been going through scans for a long time. And so I would just love to know, how do you deal with scanxiety, and how do you continue to maintain a positive mindset throughout all of this?
Yeah, for sure. Well, first of all, let's just say I've mastered a whole body MRI. So I really I think that that's something to be really proud of, is mastering a whole body MRI, that I can stay still for 2 hours. So I get, as I mentioned, I get my scans every 3 months, and, the fear of scanxiety is very real, but, I live by the motto that I live every day like it's my first. And a lot of people are like, wait, what? You live every day like you were just born? And yeah, I really do. I think every day, obviously, as a cancer patient, cancer thriver, survivor, it's a gift we've been given, right? So that is my motto. And I really think, how I stay hopeful in that mindset, and with that mindset, is because I get scans so often and so frequent, that I tell myself, if there is something there, that it's only 3 months old, since I get my scans every 3 months. And that's really helped my mindset stay positive. I've had scans, obviously, where things show up, and then it's time to tackle that new adventure. But I really think that just really incrementally focusing on the times of your scans and staying on top of being your own advocate. Your body best. I think it's so important to have that at the forefront of your mind. And just really, I live in 3-month increments is really how I live. So every time I get ready to go get my scans, I'm like, okay, here I am, another 3 months. We're going to get after it. So that's really just, keeping a positive mindset all the way through.
I love that. And that living incrementally, living in 3 months at a time. I'm going to take that and I'm going to put that in my toolkit, because I've got chills right now, because I'm just now entering the every 3 month scans. So this is new to me. I've been through, every 6 months or annual, or when something comes up, but every 3, when they threw that at me, I was kind of like, oh, that's a lot. But with that perspective and that reframe on it, it kind of gives you the power back. And so I really, really appreciate you sharing that. And
of course,
you mentioned something else that really just jumped out to me. You've mastered the full body MRI. We're not going to compare war stories here, but the cardiac MRI that I've gone through is usually about 90 minutes. And that one, every time I go through it, I've almost tapped. I'm like, I got that button. How do you manage to sit still through the 2 hours and to really just stay in that place?
I will say, I always say, every single time they get you all strapped in, there's like an itch at the top of my toe. So I think it's really mind over matter, right? So I really just put myself in a zone when I'm laying in that machine, I mean, I've mastered it to the point where I fall asleep and need to try and keep myself up. So, I really make sure, I have a great playlist. It's called my Beaten Cancer playlist. I love, I have it on Spotify, and most of the time, institutions can play your Spotify list. Of course, every institution varies, but I put my Spotify list on, make sure I'm not dancing. I'm dancing mentally, and just listen, just giving myself good vibes. If I can't play the playlist, I make sure I have just some really good tunes to just kind of zone out. But yeah, I mean, the noise is unbearable, but it's kind of mind over matter.
Truly, there's some great information, great nuggets that you put in there, and I really, really appreciate that, Lainie. Thank you for sharing. So Matt, and you all heard Matt's journey. He has absolutely been through it. This man is a warrior, the definition of perseverance. Matt, I know that you are big on, controlling what you can control. Talk to us about how you deal with scanxiety. How do you control your, all the things that you're going through and all the feelings that you're feeling when dealing with scanxiety?
Yeah, so appreciate it. Great tips too, Lainie. I absolutely love those. So for me, I have a couple of things. And the first one is, a lot of the times, we have support systems such as our family and our friends, but our family and friends aren't actually doing the scans. They're not actually going through cancer. They're there for us, but that can make us feel really lonely. And my first topic is, how do you find the right support system? Especially when you're feeling alone in this situation, you have this anxiety and you're talking to the people, but they're not actually going through it. So sometimes you just feel like, all right, they're just listening, but they might not understand exactly. And for me, what's really helped is I've had a couple of things. I was lucky enough to have my hospital, the Cleveland Clinic, have what's called the Fourth Angels Mentorship Program. And maybe you ask your hospital as well if they have something like this. And what they do is they actually connect you with a individual who went through the exact same cancer as you. And whenever you have a question, they give you their number, they give you their email, and maybe your hospital does, I would ask them. And for me, it gave me such a peace of mind when I was able to talk with this individual who had gone through the same cancer as me, pretty much. He has the same scans. And every time I'd come to get a scan, I would usually text him and be like, hey man, I'm feeling this today, I'm feeling that. And he'd walk me through how he was able to overcome it or how it was able to help him. And it was just a tremendous help. So that's my first thing, is maybe ask your hospital or something if they have a program like that, or if they have something. If they don't, a couple other things that you can do is, I actually built 2 years ago, I built a Facebook group for cancer patients, survivors, and caregivers. And I'll put the link in this. And after all this, I'm sure the patient story can send you the link if you're interested. But the whole premise of this group is to help you along your journey with cancer. Like I said, whether you're a caregiver, a patient, or somebody who's still going through it, we have close to I think about 6.1 thousand members in the group now. And it's all it is it's just an incredible family filled with love, filled with support, and, people who feel like they can relate to one another. And you can pretty much tell what type of cancer you have, and I can guarantee you there's somebody in that group that is going through something almost identical as you. So that's another thing. And one last thing is, if you do get really nervous and you have so many questions, don't be afraid to ask your doctor. A lot of the times when I would open up and ask my doctor these questions, a lot of the times what anxiety is it's made up stories in your head of, you have a scenario and you make it the worst possible scenario. But when I would talk to my doctor and he'd say, hey, that's not necessarily true. This is not necessarily true. And here's how it actually works. And here's maybe here's how you're feeling. And I've dealt with so many patients like this. He can give you a sense of ease. So those are just a couple of options that have really helped me, helping find the right support system and not feeling like you're alone throughout this journey as well.
Absolutely, man. That is so powerful. Thank you so much for sharing that. I love your vulnerability and willingness to just say, hey, I'm feeling what I'm feeling, and can you help me? Should I be feeling like this? Do you have any resources for me? Can you point me in the right direction on how I can deal with this? I love that. And sometimes I think as cancer patients, we can get just blinded by the headlights, and we almost forget that we have the right to ask some of these questions, or we forget, that it's okay to feel how we are feeling in this moment. But I love that you've got that Facebook group, because it's imperative, I believe, to have a great support system and other people that you can express yourself authentically and honestly with, that have walked a mile in your shoes. And we all are surrounded by people that love us. We have great family and friends and caregivers, but if they haven't been in your shoes or walked a mile in your shoes as the patient, it's very hard sometimes to get the sincere empathy that you're really looking for. And so the group that you have sounds phenomenal. I definitely will want that link after this so that I can join as well, because I can tell you I've gone through this journey many of my years where I felt alone, and I could have definitely used a Facebook group like that. So I'm glad that you initiated that and created it.
I appreciate it, man. And I think she did. I think the patient story just put the
Beautiful.
link in the chat as well if you want to check it out. But thank you, Nick. And I want to say one last thing is, your vulnerability is not your weakness. Your vulnerability is actually your strength. And what I mean by that is, not saying to open up to the world. You don't have to be a panelist like us and sharing your story everywhere, but being willing to open up to somebody that you can trust is like baggage getting off of your shoulders. I remember for when I first got diagnosed, for a good month, I did not want to share any of my emotions. I was kind of like a stone cold, like just afraid to share anything, thinking I was weak, especially as a man. I felt like being a man, you can't express how you're feeling. And when I finally was able to release some of my emotions and really kind of express what I was going through, I could then take away what I wasn't able to control and then focus on what I could control and where I needed to go and the steps to help heal me throughout the process. So just wanted to say that too.
And also, just to add to that, I mean, you're helping other people while doing that, right? It's so important. I think a lot of times we hold things in and don't realize, you know, when you're sharing it, it's going to help other people. So it's so important.
Yeah. And I love that we're having this discussion on this platform, because often there's another person who's got the same anxiety, scanxiety, or fear or worry, or same question that you have. And so by you being vulnerable and leading the way with that, it gives other permission to be vulnerable as well. And so I'm really glad that you guys both highlighted that. Thank you. So for me personally, there's a lot of different ways that I've dealt with scanxiety over the years, some healthy, some not so healthy. Today, I really lean more into anything that's going to improve my wellness or give me the best chance at, you know, being here long term. So I'm making decisions that that are going to give me more life, and you know, and so there's a lot of different ways that I can do that. And so one of them is by just what we were just talking about, vulnerability and being honest and naming the feeling that I'm feeling. And so that scanxiety, as we mentioned earlier, can manifest in multiple different ways and lots of different feelings and physical symptoms, mental symptoms. And so I try to name what it is that I'm feeling. And often if I can't name it, I'll pull up this feelings wheel that sometimes you'll see in a therapist's office. And there's about 5 emotions in there in the middle. And often the one that I'll start off with will be angry. And from there, I'll start looking at the other things on that and really seeing what is it that I'm really feeling. Because I know that I'm presenting as angry, but really what's underneath that anger, there's typically fear. There's typically sadness. There's typically me feeling withdrawn. And so taking the time to pull out the feelings wheel or just sit down and really put pen to paper and write out what it is that I'm feeling, and then taking it a step further and vocalizing that and sharing that with someone who is a safe and trusted source, a loved one, a friend, a family member, a peer-to-peer mentor, like, you know, the program that Matt was talking about. And I know that Leukemia Lymphoma Society has a peer mentor program as well. And so that's where that comes up. But getting that feeling out and removing the power that it can grow when you keep it inside. I think sometimes when you keep it inside and you feel like you have to be tough and put on a face for everybody, those feelings, at least for me, they grow and they bubble up and they bubble up. And, you know, then I can just explode. I can explode in the sense of just having, you know, an angry outburst or something, or throwing up. from being so sick of how I've worked myself up over the course of days or weeks leading up to the scan, and then getting there and then losing it, or my knees shaking before I'm walking in. So I have found that for me, naming the feeling and expressing that and talking about it has often taken the power away from that, and it's given me power back over the situation. Next thing that I really try to do is I try to manage my environment. And typically when we hear environment, we're thinking about like the setting around us. Well, if you've been going through scans like most of us have, there's not much that you can do to manipulate your external environment when you're getting a scan. But leading up to that, you can manipulate the environment of your home, your office, creating a safe place that feels very zen, relaxing, and peaceful, spending time there, almost kind of creating a ritual for yourself. But even just as important as it is to make sure that you cultivate the proper external environment, I think it's almost even more important to cultivate the right internal environment. And what I mean by that is really being conscious of what you're telling yourself. What's the story that you're telling yourself? And what's on repeat? What's that marketing campaign that's continuing to flash through? And so being really cognizant of that. And so for me, managing my internal environment goes to telling myself the facts. And, Matt, I think mentioned it earlier when he was talking to, figuratively about some of the things that he was thinking about and mentioning to his doctor. And his doctor's like, that's not even a thing. That's not even true. Or that's not a fact about the situation. And Matt being relieved. I do that often. I'm a master at spinning stories. I know what you're thinking, or at least I think I know what you're thinking. And when I do that, I get sick. I just keep going. And so I have to tell myself the facts. And I do that leading up to my scans. I do that in the car. And I do that while I am in the MRI or PET scan machine. And so what that looks like for me is, I am safe. I am loved. I have everything I need to live a full life today in this moment. And worrying about this situation right now, the only thing that it's going to do is it's going to change my health. It will not change the results. But if I continue to worry like this, it can and will impact my health over time. And like I mentioned earlier, one of the things that's really imperative to me is because I do want to live a very long and healthy life. I want to give myself the best chance at doing that. And I know that me stressing myself out is going to lower my immune system. It's going to open me up to infection. And being someone who's battled febrile neutropenia and been hospitalized countless times, I'm doing anything I can these days to boost my immune system. And so I have to tell myself the facts. And so often we receive information from our doctors, and we receive information that changes from appointment to appointment. But the facts are still that I am safe. I am loved deeply by my family members, by my friends, by my support system. I have everything in this moment to lead a successful and meaningful life today. And really, that's all I have control over, right? Is today. I don't have control over the 3 months from now when I'm going to go back and get my scan. But today I have everything I need to live a meaningful, fulfilling, and joyful life. And so I remind myself of that, and I have to continue to replay that tape over and over. And that's the marketing campaign or the internal ad that I have to run for myself over and over until I eventually believe it and download that. And that becomes my default. And then lastly, I've thrown a lot at you, but box breathing or just breath work in general. One of my favorite sets of breath work is a nice deep inhale through the nose for 4 seconds. So getting myself nice and calm and taking an inhale for 4. And then exhaling for 6 through the mouth. And I'll go through that, and I'll do that for about 10 times. And if I do that 10 times, in for 4, out for 6, and I stay with it, and I just focus on my breath, typically that brings me back to the here and the now. And it doesn't allow for me to start projecting myself into the future, into the doctor's office where he's reading me the results about my end of life. Because that's the way that my brain works when I start to spin these stories about getting the scan or what the doctor is going to tell me when I see him or her next week. And so all of these are things that I have downloaded to try to help myself mentally, emotionally, and physically. So just a little bit of what I have in my toolbox, but I think from everyone who's shared so far this evening that there's a lot that can be shared. There's a lot that can be taken away that you could use or utilize at your next scan or your next appointment. So go ahead.
No, I was just going to say that's so awesome. And I think, I think a lot of times too, obviously with Scanxiety, then there comes the results and all those things that like bubble up. And I think it's just something that, just while we're having this conversation and talking about, infections and, your body and just how like, it's really mind over matter, right? Because I mean, I've been in situations where I suffer from lymphedema in my left arm, and I've had numerous cellulitis infections from it. And there was a point where I got admitted to the ER. I was in the ER, and my heart rate drew so high because I was so worked up, like I was covered in highs, everything. And my husband was like, you have to calm down and take deep breaths and just put like relaxing music on. And, your box press that you did, that would have been so helpful in that moment. Right. And I think that really, they're like, you're going to be admitted into the cardiac area if your heart rate doesn't drop. And I think it's really like, those deep breaths and just really kind of getting in the zone is so important. Just in all things, in life, right? Because your body can do crazy things, but, just really making sure you're in tune with it.
Yeah, I love that. And one last thing I would say that has helped me tremendously is being prepared through my health. And what I mean by that is focusing on the foods that I eat and focusing on making sure I try to get some type of movement. I know some people who are going through cancer here, it's tough to go into a workout room and start lifting and doing all these crazy things. But even just getting some type of movement in and also eating the right foods will not just mentally, but it will physically also prepare you for the scans to come out. Meaning that if you're prepared, taking control of your health, you'll feel more confident, you'll have more courage, and then that ultimately leads to usually less anxiety. I mean, I don't know about you, but anytime that I start to eat clean foods, such as lean proteins, such as, unless you're vegan or vegetarian, vegetables, fruits, and I stay away from the fast foods as much as I can, and all the heavy carbs and all that. And I'm not saying carbs are bad by any means, but I'm just saying some of these things that are going to make you bloated. It's not good for your gut health. It's not ultimately good for your mindset. And when I feel like crap, guess what that means? It creates more anxiety into my life. And then going into that scan, I feel less prepared. But when I'm eating clean, I'm getting out and moving, and I'm doing everything I can to try to heal my body. And you're never going to be perfect. There's going to be ups and down days. And I remember at chemotherapy, there's some days where I'm like, the only thing I can eat is a peanut butter and jelly sandwich. So I ate a peanut butter and jelly sandwich. I get it. But if you can at least 80% of the time really try to take control of your health, I promise you're going to feel so much better going into these scans. You're going to feel confident. You're going to feel stronger. You're going to feel like I've done everything I could control at least. And whatever the outcome is, and I love how Lainie says this, if you're getting 3-month scans, well, guess what? The worst case possible scenario, they caught it within 3 months, but you did everything you possibly could to take care of your health. And that for me has made a massive difference when it comes to preparing for my scans as well. And what I'd love to do is I'll share with the patient story. I created actually a whole list of healthy food options, healthy snack options, and also healthy vitamins that you, of course, talk to your physician and your doctor before taking them, but at least giving you the benefits of each item. And I'll share the PDF with them, and they can, share it with you guys when this is over. But it's made a massive difference in my life. It's really allowed me to feel more confident, more prepared going into my scans.
I love that. Thank you so much for sharing, Matt. And, as we were sitting here earlier, just kind of discussing some things before we officially kicked off, there was something that was posed to us that really stuck out to me about the idea that, there can also be some relief after you've gotten, your results from the scans and actually finding out that, that there was something there, that there was something wrong. And I know, we're talking Scanxiety, but this is also another form of Scanxiety that I could definitely relate with, because earlier this in 2022, I started feeling all the signs and symptoms of my non-Hodgkin lymphoma coming back. The fatigue was starting to set in. I was having wicked night sweats every single night, beds drenched. Lymph nodes started to swell up, and I'm telling my oncologist, and I'm telling my doctors in the ER, like, I need a scan. Something's wrong with me. I had cancer last year, and I think I have cancer again. And everybody's like, no, you're fine. You look healthy. Like, you're strong. You're in good shape. You're doing all these physical activities. And that made me feel like a crazy person for a little while. Actually, yeah, for most of the time until I got my scan. I had to beg. I had to beg to get this scan. And after I got my scan and I got the results, I saw the words liver metastasis. And then I saw the words lesions. And then from there, I had a biopsy, I think a week later. And then a week after that, I found out that I had, stage 4. And now, while I wasn't relieved to know that I had stage 4 with liver metastasis, I was relieved to have my feelings, my intuition, to have that recognized and to have that validated, because I know my body. I know my body better than anybody else. I live in it 24/7, and I knew that something was off. And for people to continuously tell me that something wasn't wrong made me feel like, all of these things that we mentioned, all of the signs and symptoms or the side effects of Scanxiety, I felt those and was living with those. And there was a little bit of a very small relief, once again, because the diagnosis and everything that I was living through. But to have that relief to get the scan and know that my intuition was validated and that what I knew to be true about my body, or what I felt to be true about my body, actually was. And so I say that to remind, to cover the spectrum of Scanxiety, because it's not just one type. There's many types, and we could, interview 15 other people, and 15 other people are going to have different things that they do and different experiences with their Scanxiety. But I did want to share that and just, make somebody else that might be going through that feel seen today, that you can have the Scanxiety and almost relief, or have some of these things come up as you do find things that are on your scans and your results.
Definitely. I also think that, there was another question that came in through the chat about, obviously Scanxiety applies to treatment, right? I think treatment in its own can be anxiety ridden, right? So I think that that's definitely something, I think for me, when I was going through chemo, I've done chemo 3 different times, but I think, and I'm on treatment for the rest of my life, so I get infusions every 21 days. But for me, when I was going through like the aggressive portion of chemo, I would always just try and make it fun, right? Like, I think turn lemons into lemonade. I know that sounds so cliche, but any way you can make an experience that maybe is a little dark or not so fun, really, I think helped put me at ease. I know I would always have somebody come with me, friend, family member, and just have fun. I know that sounds silly, but I think it really, sometimes fun helps that anxiety go away, and make it into experience. And every day is a memory, right? So make it a memory.
No, that's great. That prompted something that I was thinking about here. What do either of you have a go-to treat after your scan? So you gotta treat yourself. It's like after the big moment, you've gotten out of the 2-hour MRI. What do you do? How do you celebrate, or how do you at least, kind of sigh and let yourself just breathe again?
Well, the first thing for me is I go to the bathroom. That's the treat in its own.
I love it. Yeah, for me, I know I still have scan anxiety until I get my results. And usually my results don't come for 3 to 4 days. So even after I'm done with getting the scan, I'm still kind of nervous, because I'm like, okay, I got half of it done. Now I got to get the results here. But there's actually a Panera right next to the hospital I'm at. So I'm not a huge fan of Panera, but I always just go there because it's the first thing. And usually anybody who gets scanned, you have to wait at least generally 12, sometimes even 24 hours before you can eat anything, because they need to make sure your body is completely cleansed. So right. I'll usually just go there. But once I get my results, then I take me and my wife, and we usually go to like a nice steak dinner or something, because I'm like, all right, great news, phenomenal, it's all clear, and then it's just that's kind of how I do it. So that's when I actually celebrate, is when I get the actual results for me.
I love that. I don't really have a specific food I like to eat after. All I know is I just want a big cup of water, but to get rid of that crap that they inject in your body. But fortunately for a whole body MRI, it's not fasting. So normally I try to eat a little something before, but I know, exactly, Matt, like you said, the in-between and the waiting game. I think for me, I go to MD Anderson, and I've learned how to look on the back end at my scans. And sometimes I try to pretend I'm a radiologist, and that really doesn't work. So I don't advise that. But I think, for me, I just sit there and wait. But really, I think, I don't really have a celebratory meal. Maybe it's get a coffee. I think that's the big thing, is go get a nice coffee. But I will say, when I have surgeries now, that's a different story. I like to have my McDonald's waiting for me when I'm done with surgery. It's not healthy, but just saying. The guilty pleasure.
I'll deserve a little guilty pleasure.
Yeah, exactly. But I mean, I think, too, like just talking about like fun, like traditions too, since I travel to Houston every 3 months for my scans, when I get home, if my husband doesn't come with me, I always keep my like medical ID band on. And when I get home, or after, once we get all the clear results, he has to take it off. It's just like, it's like a celebratory tradition. Like, he takes off my medical band, and it's just like, okay, yay, another 3 months to go. So, it's always just nice to have those little traditions as a cancer patient.
Wow. Man, we've got some great questions coming through, and I know that we also are getting close on time. I do want to tackle one of these questions, and you guys, I would love for the panelists, Matt and Lainie, to chime in if you guys have anything. But how do you not lose your fight? And I love that question. I think that's a very real question, and I think everybody's going to answer a little bit differently. But for me, I personally feel like there is no way that I can lose my fight by showing up and living life to the fullest on a daily basis, being the best version of the self that I can possibly be. I empty the tank every single day. And if I empty the tank every single day, meaning I live boldly, I love boldly, I try to treat others with respect, I try to honor my values and my morals. This is outside of cancer, really. At the end of the day, I really feel like if I operate like that on a daily basis, that losing is really not even an option for me, because I'm going out, I'm giving it everything I've got every single day. And I think that that's the best way that I can possibly honor life. And so really, we're all going to die. Every single being on this planet, we came into life the same way, we're going to leave the same way, gradually or suddenly. But in order for me to be prepared for that, which I don't think it's a loss, because we're all going to do it. In order for me to feel well about that, I just need to live well. And so I try to live well on a daily basis. And I feel like if I live well on a daily basis and I love well on a daily basis, then there's no way that I can lose.
I love that, Nick. Man, that was perfect. That was perfectly said. I really wouldn't have to say another thing. I guess what I would just kind of go off of what that is, going through what we're all going through makes life just a little more precious. It puts things into perspective. The things that I used to worry about before cancer, little things, or getting into some certain arguments, or feeling like I might be losing certain friends or things like that, doesn't really matter so much for me anymore. And what does matter is people who love me being the best possible version of myself, just like Nick said. And then to kind of add a little cherry on top of that is what we're doing is giving back now, being able to serve and help others. For me personally, is what gives me true happiness and fulfillment in my life. It's good to be the best version of myself, but if I can't use my experience to, at least, I have a little saying, and it's actually an acronym called HOPE, help one person every day. And that is just the motto I live by, is if I can help one person every day, I feel like, for me, being a Christian, I feel like I'm able to serve God in the way that he wants me to. I'm not pushing religion on anybody, but just that's another thing, is my faith has helped me through a lot of this. I know a lot of people here have some type of faith. I know that will help you through it as well. But just being the best version of yourself, realizing that life is just a little more precious, and not worrying about those little things, and just being at service to as many people as you can, and knowing when your time is up, you can say, I, at the end of the day, when you meet your creator, that you did everything you possibly could to be that best possible version.
And for me, Matt, I love that. And I was going to say too, for me, it's one word, and it's purpose. Obviously, we are all here for a reason, and that is purpose. And I know a lot of times people say, does your diagnosis define who you are? And I never let my diagnosis define who I am, whether, people know me as, oh, the girl who's had 5 cancers, right? Like, that's not very hard to forget, but I don't let it define who I am. I let it empower me. And I think it's so important to take, exactly like Matt was saying, like your experience, and empower others, and really just not look at cancer as a death sentence, right? Like, let this empower who you are, and let it help inspire others, because it's so important. Like, we have unfortunately been given, a gift that nobody wants. So take that gift to help inspire the others, and lead with purpose. I feel like I have obviously a social media platform that I use and share my journey, and truly believe that if I'm helping one person, that is why I'm here. And that's why I'm thriving and living every single day like it's my first.
Yes, I love it. Man, this is phenomenal. I am so grateful to the patient story for connecting us, and for, hosting events like these, that we can have real talk and discussions with other cancer patients, caregivers, and family members that are in the trenches, because we need it. We need it. Nobody fights alone. And I'm just very grateful to the patient story for putting this together and hosting this and sharing all of these resources after. And so thank you. And thank you, Lainie and Matt. I'm going to kick it over to Alexis, and she's going to give us our closing remarks and kind of wrap everything up for us here.
Yes, thank you three so much. And those who are joining our live discussion tonight, cannot thank you enough. And we will have a survey as soon as you click out of the webinar. So make sure you do fill that out. It helps us kind of know what to do next. And also, please let us know what topics you would like us to cover, what would be the most helpful. We definitely want to continue these live discussions and make sure that they are educational and also helpful to the patient and caregivers. So again, we are the patient story. We will have more live discussions like this. You can also find the latest patient stories and also the new medical news also on our platform. So please head over to our website, and we have all that information, and we will be sending out an article with everything that was discussed here tonight, along with the full video. And we'll also put in the contact information for all 3 of our wonderful panelists tonight. So thank you, Nick, Matt, and Lainie, for joining our discussion tonight.
Thank you.
Thank you.
Thank you so much.
Have a great night, everyone.